All right, here's a quick recap on appendicitis. Okay, appendicitis. If you break down that word, what does it mean? Inflammation of the appendix. Okay, this is usually acute. All right, and it's characterized by rebound tenderness. Okay, if I can that's my way of underlining. Okay, saying it under rebound tenderness. That's my underline. All right, in the right lower quadrant. Okay, right lower quadrant of the abdomen. Okay, patients may experience nausea and anorexia. Okay, white blood cell count greater than 10,000. All right, and it requires emergency surgical intervention. Okay, emergency surgical intervention. Why? Because we do not want this to erupt in the abdominal cavity. Okay. If it's inflamed, it has all sorts of things that's building up in there. It's red, it's swollen, okay? Pus, bacteria, all of that could be inside there, inside that appendix wall. And we don't want that bursting out into our abdominal cavity, contaminating the rest of our abdomen. No. So, surgery, okay? An appendectomy to remove the appendix, all right? But before we get there, what is this going to look like? Our subjective and objective assessment. Subjective assessment, they are going to complain of pain. Pain in the right lower quadrant, specifically your McBurney's point. Okay, again, nausea and vomiting. They're not vomiting, sorry. They're going to complain of nausea, all right? Which can potentially lead to vomiting, depends. Which can potentially lead to vomiting, also some fever, all right, elevated white blood cell count, as I stated, the rebound tenderness, rigid abdomen, and decreased or absent bowel sounds, okay? Depends on like what's going on in there, all right? But again, you will get all of this from your assessment, okay? Your nursing interventions, explain the tests and procedures to your patient, okay? After the physician has already done so, not before, okay? But bed rest, NPO, okay? NPO, why? Because they will have to have an appendectomy, okay? That sucker needs to come out, okay? Replace fluid and electrolytes, monitor the vital signs, assess and treat the pain. Do not apply heat to it, and no enemas, okay? No enemas, no heat, okay? And that is appendicitis.